first week, and that means Squish is due in just about 2 months, give or take a little bit, of course. Anyways, I have a couple things to talk about this week. The big thing is I had another appointment with Dr. Andrews, and it also went just as amazing as the last two did. He is just so fantastic. I just cannot say enough. Every time I see him, I like him more and more, and I'm just so glad I switched to him. He's pretty awesome. My blood pressure was up a little bit. It's still been within the same range, but it was up a little bit. The first time the nurse took it, it was kind of really high. Like 157 over 90 or something, which isn't like super duper bad, but it's high. And then she was like, let me try the other arm. So she did the other arm, and then it was 137 over 88, which is borderline high, but not really too bad yet. The nurse has always seemed a little bit concerned when she takes it, but again, I get to actually seeing Dr. Andrews, and he said, your blood pressure and your weight gain are great. So I was like, so about that, you know, like how high does blood pressure have to be to worry you? Because last time I was induced, my blood pressure was around the low 140s to high 80s, low 90s when they started talking induction. So I'm like, I'm almost there. What does he think is bad? And he said, well, he's like, looking at your readings, they've all been around the same neighborhood, so for you this is your normal, and you don't have any protein in your urine at all, so I'm not worried at all. He said for it to get to the point that it worries him, he's thinking, you know, neighborhoods of 160 over 100, but he said even if it got to that point, doesn't necessarily mean freak out and get the baby out. He said we would try medicating the blood pressure first, bed rest, you know, other things to address it before we would worry about delivery. He said he would see me more often, make sure me and the baby are doing good, and as long as we're both doing good, doesn't necessarily mean that she has to be born immediately. I do remember him talking about how he doesn't like to induce VBACs, and honestly, it seems like he doesn't like to induce, period, which is good, because it really should be kept for, you know, medical reasons and not elective. So I asked him, you know, if there was something like preeclampsia, something that babies should be born sooner rather than later, but not necessarily in the next 15 minutes, like, you know, emergency C-section, you know, is induction at all an option, or is it completely off the table, and if she needs to be born, it's a C-section? And he said, well, I don't like to use chemical induction methods because they make the uterus contract more strongly, which increases the risk of uterine rupture. Though it's still a very small risk, it's still a bigger risk, and I like to try other things first. So he would suggest nipple stimulation and other things prior to actually going towards a medical induction. But it seems like, since he doesn't worry about dates and he doesn't overreact about things, that the chance that I'm going to actually need to be induced is next to nothing, and the chance that he would actually recommend a C-section being safer than a VBAC seems next to nothing. So I think my odds are really good that I'll get to go into spontaneous labor and have a really good chance of having a successful VBAC, since he said the chance of success is about 75%, which is what ACOG's statistics are as far as of women who are actually able to get to the point of trial of labor. They're about 70-75% chance of being successful. Unfortunately, because there's so many providers and hospitals who are not supportive of VBAC, still go by the outdated information of once a C-section, always a C-section, there's only about 8% of all moms with previous C-sections having VBACs. That's pretty sad. So anyways, of course there's some women who have the option to VBAC and choose not to, and that's totally different. And then of course there's some that it's not safe to attempt a VBAC, like if they have placenta previa. Obviously, you know, obviously you can't have 100% of women who've had C-sections having VBACs in subsequent births, but I really, you know, it really should be more than 8%. That's kind of bad. I asked him about pushing positions. He's cool with that, like with whatever I want to do. You know, he said as long as baby's happy, you know, if her heart rate starts doing weird things or something like that, then he might suggest, you know, changing positions, doing something different. but he doesn't care. He's also fine with mother-directed pushing. You know, if I do feel the urge. He said the problem is a lot of the times if a mom has an epidural, she can't feel the urge to push. So obviously they need to be coached on when to do it or they won't know. I doubt I'm gonna have an epidural though, so I don't want one, so I'm not planning on one. So as long as I'm pushing like correctly and I know and I feel an urge to push and when I should push, then he's fine with me just doing my thing, which is great because that's a big part of hypnobabies is breathing the baby out and just following that instead of, you know, directed pushing, purple pushing where you're holding your breath. He said, as I suspected, they like to have continuous fetal monitoring for VBACs, which is not a big deal to me. I'm used to it. I had to do it with Cal since I was induced, and you can still move around quite a bit even if it's not wireless. So I'm not really concerned. I kind of expected that, and to be honest, I've gone back and forth about it, and I kind of prefer it for VBAC since then I can just continue to just have it already there and do my thing instead of having to stop every so often to have them check it. And also, I think it would be reassuring for me to know that she's doing okay and that one of the accurate signs of uterine rupture is fetal distress. Not everyone feels pain, you know, epidural or not. It's, if I remember the statistics, is actually more often than not you don't feel the pain of it. So I like that there's something that's accurate that they can go off of to know that something's wrong and then be able to do the emergency C-section and be able to save both of us. I don't know where I read it, but something said, you know, if you have a rupture, if you get the baby out within 18 minutes, that like almost never is there any lasting damage. The catastrophic uterine ruptures, which is when baby has brain damage or one or both die, is very extremely small. It's more likely to miscarry a baby from a amniocentesis than have to lose the baby to a uterine rupture, so I'm not real worried about it. I don't think it's going to happen, especially if he's not into doing chemical inductions, and the chance is even smaller. Back to the thing about induction. So he said it would depend on, like, basically most of the questions I ask him, he says it depends on the circumstances. So that's the good thing, that he treats his patients like individuals and what, you know, is going on with their particular case rather than just rigid protocols. So he said, you know, if I had a great Bishop score, then he'd be more inclined to attempt it. But, you know, if baby's not doing so good, baby needs to get out, and my cervix are closed, high and tight and thick, and it's just, you know, it's just not always a good idea to even attempt an induction. Because a lot of times if your body's not ready, it's going to fail, and the amount of medicine needed to actually make it happen would be higher doses, which would be even riskier. So I think that's perfectly reasonable. I know when I was induced with Cal, I had like the minimum Bishop score that they say you should have in order for it to have good chance of being a successful induction, and it was. I mean, it got going. It took some time though, and that's the thing. So, you know, if baby's not ready and you're trying to push it, you know, sometimes it doesn't work. But I appreciate that he's willing to just wait and see what happens and see the circumstances. Something that we can discuss when the time comes, if the time comes. I trust that he has fair judgment on that, and that it can be an informed decision that he and I can make together as a partnership, not a dictatorship like he always says. Oh, I clarified on the rule about video. So I said, is it just like literally the delivery itself, or just not at all? Because there was something that the hospital had on their website that made it sound like you couldn't get any video at all until after the baby's born. And he said just the delivery itself. So we can definitely have some footage for the vlog, which is nice. So it was a great appointment again. My overall weight gain is about 22 pounds, I think, which is how much I gained total with Cal, but I also started out 20 pounds heavier than, so right now I weigh just a little bit more than I weighed when I got pregnant with him. So he said it's a good, I think I remember reading somewhere that you want it to be around 30 to 35 pounds, so it seems like I'm on track for that exactly. I definitely don't feel like I've gained excess weight. It's just kind of you know, all that stuff adds up. The extra blood, the extra volume in your uterus, the amniotic fluid, the placenta, the baby. I mean, just all that stuff alone is a good almost, it's like 15 to 20 pounds depending on how heavy your baby is. So, you know, anyways, so I just wanted to show you guys, a couple weeks back I showed you some of the gender neutral newborn diapers that I had ordered before we knew what we were having. So this time around I want to show you the girly newborn diapers that I got because they're just so cute. These ones I got on eBay, I think. They're Charlie Banana newborn and they're just so little and cute. Also on eBay I got these 3 covers for a good price. There's a blueberry and 2 rumper rose and they're so cute. Also on eBay, the seller, she takes receiving blankets and then she upcycles them and turns them into newborn fitted diapers, and I thought that was really cute. So there's this owl one, and this one was one she had pre-made, so it's just a white interior, but she also had the option to custom which ones you want it. So this one's got this pretty flower motif, and then inside is the stripe, and then this one's little cats. How cute is it? And inside are little flowers. So I think they're really cute. I'm excited to give them a try. And lastly, I got this from another mama in a Facebook group that I'm in. It's all for pregnant women, and it's an offshoot of a baby wearing group that I'm in. And it's a Muddikin baby, which is a very popular brand. I've never tried it before, but I saw these and she had them for such a good price. I want to say it was only $7 shipped. And it is so cute. It's little birdies and it's so little. So this is a little fitted as well, but it's got a lot more absorbency. Look at this. Probably put her in this for any time she's going to sleep for a while. I mean, I would say overnight, but clearly with a newborn, there's no overnight diapering. They wake up for feedings. They usually poop at least once through the night, so you can't leave them in a diaper all night long. You have to change them. So that's good. You don't have to worry about having as much absorbency because it doesn't have to go the distance like it does for Cal. So anyway, those are now part of my stash. I'm really excited to try them. I have just a couple more that I'm waiting on coming in, and then I can start prepping everything in a couple more weeks and have those ready to go. I still need to wash some of the clothes, like some of the newborn clothes that I'm going to want to have to put on her right away. I'll worry about the rest of it after she's here, and just to make sure, kind of glean how much newborn she actually needs and whatnot, depending on how big she is. Cal was pretty big when he was born, but he was still a newborn for a month to a month and a half, depending on the brand it was. So we'll see. But still so many things to do. We still have to finish Cal's room, see how he does sleeping in his own room. So far he's in his own bed, but his own room, and we have, I just feel like a million things and not that much time to do it. So anyways, I'll see you guys next week. I'll have some kind of exciting things to talk about in the next installment. So till then, bye!